Good morning. Welcome into Today in the Napa Valley, your Chamber of Commerce Napa edition. I'm Ira C. Smith, and we've got some interesting people with whom we will be talking about a variety of things, one of which is to congratulate the Large Business of the Year from the Chamber of Commerce Annual Awards presentation, their luncheon this past month. And let's say good morning to the guy that is I guess you'd say, the man over at the Doctor's Company. And you might say, well, what's the Doctor's Company? We're going to find out because it is the Large Business of the Year. Dr. Richard Anderson, good morning, and thanks for coming in.
Good morning. My pleasure to be here.
Well, let's find out a little bit about you first, and then we will find out about a little more about the Doctor's Company, which is such a part of our community that some people may not know too much about. So your background is what?
I'm a physician. I practiced oncology in San Diego for 25 years at Scripps Hospital and University of California, San Diego. Mm-hmm. And then I moved to Napa to become chairman of the Doctor's Company and then CEO. I'd been insured by the Doctor's Company. In other words, the Doctor's Company provided my medical malpractice insurance since my first day in practice, so I was very familiar with the company.
Mm-hmm. Okay, well, let's find out more about the company. So give us a little history of the Doctor's Company first.
Well, first of all, the Doctor's Company provides medical malpractice insurance to its members. Its members are physicians, and the physicians own the company. So it's very much like a mutual company. We're the largest physician-owned medical malpractice insurance company in the United States, and we insure more than 80,000 doctors nationwide. We're also by far the largest medical malpractice insurance company in the state of California, and our national headquarters have been in Napa since 1990.
Well, let's focus on the location now. Before the Doctor's Company moved into Napa, what was this location?
When the Doctor's Company was interesting, it's an interesting history, I think. In 1975, there was this major medical malpractice crisis in California. Those of us who were active during that period of time will actually remember it was an era of actual physician strikes. And it was a time when physicians and their spouses actually occupied the Capitol Rotunda in Sacramento, demanding legal reforms to protect against the onslaught of legal litigation. Remarkably, that the governor at that time was none other than Jerry Brown, of course, our immediate past governor. Mm-hmm. Legal reforms, in fact, were enacted in the legislature, but by that time, commercial insurance companies literally refused to insure physicians against medical malpractice. Their rationale was the practice of medicine was too risky to be insured. So physicians were left with no option other than to form their own companies. And so the Doctor's Company was founded by physicians for physicians in 1976. Mm-hmm. We had two offices at that time, one in Northern California, one in Southern California, and it became impractical to have a bifurcated headquarters. So a California-wide search was done, and remarkably, Napa was the choice. Mm-hmm. And so that we moved into Napa much later, 20 years later, but that's how we came to be in Napa.
But what a nice facility you were able to move into.
Yes, well, I think our timing was remarkably fortunate. 1990 was probably, except for 2007, 2008, was the last real estate dip in Napa. We're on the corner of 12 and 29, and that is even now that huge development has been 20 years in the making. It was a large open field. So we were welcomed with open arms by the county. Our building was built on time, actually ahead of time, under budget. And it's been a wonderful facility for us ever since.
What was in that location prior to your moving in and setting it up?
Pasture.
Just his own patch. So everything is new for the doctor's company.
It's new, yes. Right.
Mm-hmm.
Yeah.
Now, you are the Chamber of Commerce Large Business of the Year, so tell us about your employees. How many do you have, and are they full-time or are they part-time, or what can you tell us about your personnel?
Well, we have about 200 full-time employees who are in Napa. Here in Napa, we have about 800 altogether nationwide. But this is our headquarters and by far our largest office.
Mm-hmm. Give us a little bit of information about the number. You said something about the number of physicians that you do insure, and that's all across the United States. Does it go outside the United States at all?
Right. So, a good question. So, it's 81,000 in the United States, and no, we don't insure outside the United States.
Mm-hmm. And are these all types of physicians, or?
Yes, we insure every kind of medical practice, every specialty, and also we insure every type of medical institution. In other words, we insure, of course, doctors' offices, but also outpatient facilities, hospitals, integrated delivery systems, academic centers.
Was there any one specific reason why you located in Napa?
Well, I know it sounds odd now. As I say, at that time, the doctors' company's bifurcated headquarters at that time were between San Francisco and Los Angeles. And so the search firm that we hired to unite the headquarters into a single facility discovered Napa as a low-cost, well-located place. And I smile now because it's been wonderful for us, but I think low cost would probably not be the appropriate adjective for today.
Uh-huh. Well, you talked about malpractice and all. So could you tell us about some of the issues that do come forth there at your location?
Well, so physicians are litigation against physicians, medical malpractice suits, are distressingly common. I think that people don't understand how often even the very best physicians are sued. For example, if you're a neurosurgeon, your chance of being sued in any year is about 1 in 2.
Wow.
So the average neurosurgeon has one suit every 2 to 3 years. Meaning if you have 5 neurosurgeons sitting at a table, all 5 of them some of them are actually in court, and all of them will have had a suit over the last 5 years. Mm-hmm. Other specialties with similar kind of risk profiles, obstetrics, orthopedists, emergency room doctors. And so the amount of litigation against physicians is, in my judgment, unconscionable. The definition now, of course. So what happens to all of these suits? Of course, the argument is made that the medical malpractice system identifies bad physicians, but if that were the case, then we wouldn't win 82% of all the claims.
Wow.
So when you think about it that way, if we say that futile litigation, as opposed to frivolous, we won't use the word frivolous, we'll call it futile. But futile litigation means we go through years and years of court, legal process, and all of that. And at the end of the day, the plaintiff ends up with no indemnification whatever because the system finds there was no medical malpractice. So there's something wrong with the system where 82% of the suits turn out to be without merit. The analogy that I use, if we had a prosecutor who prosecuted the innocent 82% of the time, or a policeman who arrested the innocent 82% of the time, we wouldn't tolerate it. Mm-hmm. But this is the system that doctors practice under.
Mm-hmm. Yeah, we're talking with Dr. Richard E. Anderson, who is CEO of the Doctors Company. And tell us what this means as far as the general public and why the general public should show concern.
Well, there are several reasons. One is the system of medical malpractice insurance is designed from a public point of view to be certain that patients who are injured by actual medical malpractice have indemnification money actually available to them. In other words, the vast majority of all litigation is actually paid for under these insurance programs. So from the patient's point of view, this is the pool of money that indemnifies patients who are injured. So that's one aspect of it. But the other reason, and a public value there that we recognize. The other aspect, though, that I think people do need to be concerned about goes back to that 82% of non-meritorious suits. The cost of that is enormous, and at the end of the day, it becomes part of your health care bill, our health care bill,
right,
and the nation's health care bill. Medical malpractice insurance is an overhead cost of practicing medicine, whether you're an individual doctor or a clinic or a hospital or a dialysis center. All of that gets added into the ultimate cost that every one of us pays to get our health care. And to the extent that medical malpractice insurance is unaffordable, or to the extent that, let's say, an obstetrician in a rural area literally cannot afford medical malpractice insurance to cover deliveries, access to care is seriously impaired.
Mm-hmm. With the emphasis on the doctors there at the doctor's company, how much emphasis is put on lawyers? Do you have a lot of lawyers on the staff?
We have some lawyers on the staff, but actually fewer than 10.
Well, really?
So and the reason for that is that we hire the doctor's company on behalf of our members hires highly qualified, well-screened defense attorneys for whom this is their career. And the reason that we prefer that system is that means that every doctor has their own lawyer. Not a company lawyer. They have their own lawyer, and so that just as we believe the doctor-patient relationship is critical, we also believe that the lawyer-client relationship is legal. So we provide a lawyer whose primary interest is dedicated to the doctor.
Mm-hmm. So the doctor is trying to do good. He is trying to do the best he can for an individual or something. But what does he have to watch out for as far as a suit or a malpractice coming against him? Is there a particular guideline?
Yeah, no, that's a great question. I think the answer to that question, I think, brings us really to the crux of the problem in our current system, which is that, by and large, any unexpectedly adverse outcome in healthcare poses a risk of litigation, whether they're known complications of a procedure, but known complications, they may well be known, but almost invariably they're unexpected. Disappointment. All sorts. I mean, as biology is not an automated machine line. The human body is mind-numbingly complex, and the ability to predict the outcome of complex drug therapies or complex surgeries or fight against very difficult, challenging multiple diseases at once. It's not an algorithm, and so. That's part of it. The other part of it is that medicine is so remarkably good, modern medicine, that we as a public and as patients have come to expect miracles. We're all aware of medical miracles, and we're thrilled with it, and the practice of medicine gets better, more remarkable, and safer every year. But it's a long way from being 100%. It's a long way from being able to know and certainly to guarantee outcomes. But in our society, a very litigious society, of course, adversity always looks for a means of compensation. And medical malpractice suits are so reflexly ingrained in the culture of the United States that we have, in my judgment, far too many of them.
Mm-hmm. Yeah, I can understand that. We're talking with Dr. Richard E. Anderson, who is chairman, the chief executive officer for the Doctors Company. And let's focus now on your position, as you are a physician, but are you active as far as the medical profession now?
Right. Well, I practiced oncology, so I was a cancer specialist for 25 years. I practiced at Scripps Hospital in San Diego and University of California, San Diego. And then I have clinical faculty role at Stanford for a number of years, but I have not practiced for more than 10 years.
Mm-hmm. So now your job is to look after the other physicians around the country.
Right. That's right. And so for me it's a wonderful job. It's a great privilege to occupy this position. The mission of the Doctors Company is to advance, protect, and reward the practice of good medicine. So as an individual physician, I can do everything I can to make sure that my medical care is as good as I can possibly make it. But as CEO of the Doctors Company, I have a powerful platform to advance the practice of good medicine throughout the country. We collaborate actively with major specialty societies. We don't set standards of care, but we provide data that elucidate what best care should look like. When those standards are agreed to by professional societies, the Doctors Company helps promote those standards to educate our members. We have more than 50 people who do nothing but patient safety education and work around the country. We're also active legislatively, seeking legal reforms in terms of making the courtroom environment less onerous for physicians, but also facilitating the practice of good medicine around the country.
We'll be back and continue our discussion with Dr. Richard E. Anderson in a moment. We'll find out more about major issues that face the malpractice industry, the medical malpractice industry, after this time out. We continue now with Today in the Napa Valley, your Chamber of Commerce Napa edition. I'm Ira C. Smith, and we're talking with Dr. Richard E. Anderson, CEO of the Doctors Company. Okay, well, let's find out more about defensive medicine now from Dr. Anderson. So what can you tell us is happening in that field?
Yeah, I think, in a way we could say that defensive medicine is the 7/8 of the iceberg that's below the water. We see the suits, that's above the water, but we don't see the defensive medicine, and because it's invisible. But it's a tremendous problem. We always talk about what is the standard of care, and of course implicit in that notion is the standard of care is a medical standard of care. What would good doctors under reasonable circumstances, what judgments would they make, and what actions would they take? But the reality is, in this society, after literally hundreds of thousands of medical malpractice suits over the past several decades, our standards of care are no longer really strictly medical standards of care. They're medical legal standards of care, meaning what should you do to win your case in court, not what is the ideal case what is the ideal paradigm for patient care. So doctors doctors do order more tests that are often necessary. They sometimes avoid seeing patients who where the risk of complications is inherently very high, and the result is more testing, more risk for the patient, more cost for the system. There have been a number of national studies throughout the years, and the minimal estimates of the cost of defensive medicine are in the hundreds of billions of dollars every year. And just so almost to pause on that number, hundreds of billions of dollars of wasted medicine. And I think that, too, is a point I would like to emphasize. Sometimes people will argue, well, defensive medicine is good. I want my doctor to order every test. I want to be absolutely sure. And that's a conversation, but it's irrelevant, because if defensive defensive medicine, by definition, is not good medicine. If it was good medicine, it wouldn't be defensive medicine. So defensive medicine is 100% waste. And we're talking about hundreds of billions of dollars a year.
Wow.
Yeah. Mm-hmm.
Well, with the standard of care you're talking about, what about the cost then of care beyond that aspect?
Yeah, so all of that gets built into all of that extra testing, all of the issues that evolve out of defensive medicine. All of that gets built into the cost of care. I mean, at the end of the day, we all pay for those extra bills, those extra prescriptions, those unnecessary X-rays. Right. And when I say unnecessary, but the fact is, if they were necessary, then we wouldn't call them defensive medicine.
Mm-hmm. Do you very often get visits from physicians from outside the Napa area that want to come in and just acquaint themselves more with the program and with your facility?
We occasionally do. I don't know that most physicians around the country fly out here to visit their medical malpractice carrier, but we do see occasionally people who are visiting the Napa area, our members who are visiting the Napa area, who do stop by and say hello. We invite during the course of the year hundreds of physicians, though, to come to Napa to medical specialty groups so that we can discuss latest developments in care. We can review with them the data that we have, because the data that we have on medical malpractice litigation is a very important educational tool for the profession. And there are a couple of large national databases of medical malpractice claims that are very useful for study and education. But the Doctors Company database is unique because it's uniform. It's the same company with the same standards, the same system, the same codes used over 3 or 4 decades, whereas others tend to be a heterogeneous collection of data inputted from multiple sources. So the Doctors Company Claims Database is really a unique national resource, which we are most happy to share with the profession. Mm-hmm.
Is there anything comparable to this for nurses?
Medical malpractice, yes. Virtually every nurse has medical malpractice insurance. Many nurses are employed, and then typically the employer pays for their medical malpractice. So if they work for a hospital, for example, typically their medical malpractice insurance.
But is there one company that handles this?
Oh, one company. There are a couple of large companies that insure the majority of nurses, but there are a number.
But it don't have anything like the Doctors Company, like the Nurses Company.
Oh, no. There's not a single. Yes, good question. Yes, no, I'm sorry. Yes, you're right.
No, you think of people in the medical profession. Well, it doesn't just stop with the physicians, but anybody that is extending care.
Everybody, that's absolutely right. And one of the things that we all follow with interest now is that as nurse practitioners assume more and more responsibility throughout the healthcare system, what will the pattern of litigation against them actually look like? Historically, actually, nurse practitioners have a very admirable profile in other words, a low amount of litigation against them. But it'll be very interesting to see as they become more and more central to the delivery of care in the United States, what happens to their litigation profile.
Mm-hmm. Now, after someone has graduated from medical school and gets, I guess, is authentically in the professional, do they contact you, or how do they get connected with the Doctors Company?
Yes, they contact us. I mean, there's a number of different ways. They can contact us directly. Mm-hmm. They can contact the company directly. We have agents, insurance agents who represent the Doctors Company throughout the country. Mm-hmm. And then also, but often in today's world, most doctors are not finishing their residency and hanging out a shingle. Most doctors are joining established medical practices or groups or institutions. And so typically, graduating doctors are getting their first medical malpractice insurance company from the group that they join, or through the group that they join.
Well, it certainly is something that we need to know more about as far as the Doctors Company. We hear about it, and you've enlightened us on what is happening out there, what you do, and the numbers that you represent. Is there any other aspect of the Doctors Company that you'd like to share with us?
Well, let me just one word. I mean, we're very proud to be part of the Napa community. We've been here now for 28 years, and we were affected. We were affected by the wildfires, as everyone in the region was. Several of our employees lost homes. My wife and I did not lose our Napa home, but we did have to sleep on the floor of the office for 5 days. And I just want to express our gratitude to the first responders and the second responders who ultimately put the fires out, and the second responders who have worked to repair the damage caused by the fires. You know, the personal and personal damage, and humane society's human damage, the support necessary to recover from a catastrophe like that. So we're very grateful for that.
Well, we're grateful for all that you do, and I know the Chamber appreciates your service, and that's one of the reasons that you were selected as the Large Business of the Year by your Napa Chamber of Commerce. Thanks for finding time to come in and tell us more about your company, and we feel now that we know more about our neighbor out there, the Doctors Company.
Thank you very much.
Yeah. We've been talking with Dr. Richard E. Anderson. He is the chairman of the board, the chief executive officer with the Doctors Company. Stay right there. We've got a lot more coming your way here today in the Napa Valley.